Banner Health Heart Failure Innovation.
Well, I've got congestive heart failure. Last time I went to the hospital, I had to stay 6 days.
Banner Heart Hospital and Banner Home Care are working together to help keep Esther and other heart failure patients out of the hospital.
Banner Home Care has been on our heart failure leadership team since the beginning. Actually, one of the milestones we used was the home care and telehealth. We used both of them as metrics for our initial accreditation. They have grown with us. They have been part of our journey in trying to figure out how we're going to educate patients, because we need to educate them in the same terms, the same language, the same information in the hospital as we do at home.
Our telehealth program with Banner is technology that we use to educate the patient so we can empower them for self-care after the nurse discharges them. So they have the telehealth equipment in their home for approximately a month. And we take out a scale and a blood pressure machine and an oximeter. And we teach them to weigh themselves every day about the same time. And they take their blood pressure and they answer a few questions on a monitor that's hooked up to a phone line.
Having home care helps me stay in my home.
Hi.
Hello.
How are you?
Good, okay.
For Esther's daughter, Alberta, it's about the peace of mind that comes from knowing her mom is being well cared for.
Having the Banner Health Care does give me peace of mind. Having her monitored daily, her weight gain, her blood pressure, oxygen level, pulse, and then it goes into the nurse. If there is a problem, we are notified. I like seeing these new innovations and how they're helping my mom. The hospital's not fun, and she does not like it. She's more comfortable at home. She gets better rest at home. If we can take care of her at home, we feel that's better for her, as well as probably not as costly.
The high costs associated with hospital care and readmissions for heart failure patients is a focus as Banner Health enters its innovation phase and looks to the future.
The forces drove our continuum building was really to address two things that are coming. They aren't here yet, but they're coming. One was readmissions, because that's going to have to be lower, and we're going to have to do that with the same high quality. And the other one is the pressures that's going to be on us to manage the continuum, or through a bundled payment mechanism. So in the near future, it's going to be a bundled payment structure for 3 days before an acute episode and 30 days after an acute episode. And we're going to have to learn how to manage all of that. As we look at continuums of care and look at delivering care across that continuum, this is a totally new model by which we'll be delivering care. And I think it's going to be widely adaptable throughout Banner. So learning how to manage patients in a different, on a different platform, so to speak, over a wider range of time that we didn't have to do before. We have to innovate and create the model to be able to do that. And so this is innovation at its very best. And if we don't do something like this, we're in trouble. You know, if we do something like this, I think we're going to be setting ourselves up really to move into innovation in a big way and ultimately be an industry leader. They're all going to come to Banner to figure out how we did it. They're going to come to us to figure out how we did it. And isn't that industry leadership at the end of the day?